Hello, I am Dr. Ari Seidenstein, and I am a joint replacement specialist at Rothman Orthopaedics. If you were previously told that you were a candidate for total hip replacement and are still awaiting surgery, I am here to give you a few tips as to what you can do from home to help decrease pain in the meantime. Home exercise can be extremely helpful. The goals are to increase muscle control, strength, and movement patterns around the joint. This leads to increased stability as well as decreased stiffness and inflammation, and enables the patient to avoid the most painful movements around the arthritic joint. Furthermore, exercise can help relieve stress, improve mood, and reduce anxiety. And for those patients suffering from arthritis, keeping a positive state of mind is just as important as maintaining a normal level of physical functioning. For an instructional packet of appropriate exercises for patients with hip arthritis, please call us at Rothman Orthopaedics. That being said, here are a few helpful hints that can help the patient get the most out of their home exercise program. First, allow sufficient time to warm up prior to exercising. Patients with arthritis typically need more time than others to warm up, so allow for 10 to 15 minutes prior to starting your exercise. Good warm-up activities include stretching, walking, and marching. Next, apply heat to the joint prior to exercising. As with warm-up activities, this is another good mechanism to increase the temperature of the joint to reduce stiffness, improve flexibility, and reduce the likelihood of injury. And lastly, cool down after exercising. As with warm-up activities, patients with arthritis typically need more time to properly cool down. Stretches are excellent cool-down activities, as are slowly walking or biking. Ice packs can also be applied to the joint to help reduce pain and stiffness post-workout as well. Most importantly, if certain exercises seem to make the pain worse, or the hip becomes swollen after exercise, do not continue and consult your orthopedic surgeon. Patients are advised to listen to their body and to stop exercising and call their medical doctor if they experience any worrying symptoms such as nausea, vomiting, headaches, chest pain, shortness of breath, or other medical symptoms. Whether obtained over the counter or via prescription, medications are another option for patients with hip arthritis. Tylenol, as well as oral and topical anti-inflammatories, can help both reduce pain and inflammation. Please ensure to consult your physician prior to taking any medication to make sure you are taking them appropriately and to make sure that they do not interfere with any other medications you are currently taking. And remember, if one anti-inflammatory does not alleviate your symptoms, that does not mean that there isn't another one that can. Different patients respond to different medications differently. This brings me to my last and possibly most important point. Losing weight is always a good thing. Aside from the beneficial effects weight loss has on the entire body, losing even a small amount of weight takes incremental amounts of stress off of the hip joint. Moreover, studies show that morbidly obese patients have a much higher risk of complications following total hip replacement. Therefore, losing weight not only helps the patient preoperatively from a symptomatic standpoint, but also postoperatively in regards to a good surgical outcome. Finally, I do hope that this video finds you and your families otherwise healthy and well, and that these recommendations have been helpful. I do encourage anyone with any questions to reach us at Rothman Orthopaedics.